Using a simple but powerful evidence-based conversational approach with parents and caregivers, clinicians can preemptively talk about safe and healthy relationships in highly effective ways. The approach is called CUES, which stands for confidentiality, universal education and empowerment, and support. Let's look at how a conversation involving cues might enhance a pediatric clinical visit and extend support in an interaction with caregivers.
Well, everything looks good, and she's gaining weight nicely. She's meeting all the developmental milestones.
Great.
How's feeding going? Are you breastfeeding using formula or both?
It's going okay, I guess. I try to breastfeed her on demand, but it's really hard sometimes. I started giving her formula maybe every 3 hours. Is that okay? Is it bad for her and healthy? My husband says it's bad for her.
It's not unhealthy to use formula. She's gaining weight nicely. You are doing an amazing job. Can you share a little bit about your thoughts around feeding and starting formula?
Um, I don't know. Sometimes I feel like she's still hungry, and I don't know. It just seems like she doesn't get full, and it just seems like she just wants more and more, and she cries a lot. Maybe it's because I'm not producing enough milk. I don't want her to be hungry, and my husband gets really mad when I give her formula. He says that it's not natural or healthy for her. Sometimes I don't like when he even knows that I give it to her, but if she's hungry, like, what am I supposed to do? Like, I don't want her to keep crying, and she seems happier after she's had a bottle.
Of course, you don't want her to be hungry. While breast milk is best for a growing baby, it's perfectly fine to supplement with formula to give her the additional food she needs. You're doing the best thing for your baby. And look what great weight she's gaining. And I also want to share that we have a lactation consultant here to help support our families with breastfeeding. She's wonderful, and she's available to talk if you need it.
Yes, thank you. I'd love to talk with her.
Okay, great. I'll arrange that referral before you leave today. You know, having a newborn can be very hard on parents. It also can be demanding and stressful at the beginning, breastfeeding as well. Hearing you say that your husband gets really mad when you use formula, or that sometimes you feel more comfortable hiding it from him, makes me wonder if there's something going on at home. Is there anything stressful or even scary going on at home or happening to you or your baby? I do want to share that this is a safe space. Anything you tell me is confidential, meaning I won't tell anyone else. I always like to tell everyone, though, that if anyone tells me that their baby is being hurt or that they want to hurt themselves, I may need to share that information with others. And I'm here to provide support.
Yeah, it's stressful at times, mainly when my husband gets upset.
I can understand that. That's probably very hard at times. You know, scary things like violence or abuse at home are very common and can have harmful impacts on parents and their children. It is actually so common that I talk to all my patients' caregivers about it. I want to help your child and you be healthy and also safe. I want to share these resources I give to all of my patients' parents. I give everyone two of them, so you have the info for yourself, and you can give one to a friend. We all know someone who's struggling, and we may not know how to help. It talks about caregiving, managing stress as a parent, and how relationships can affect parenting. It also talks about situations with partners who hurt you or control you. On the back, it has numbers for free anonymous text and 24/7 helplines in case you ever need help. Is this something you would like to take home or even take a picture of?
Yeah, sure. I can take it. I definitely want to give one to my sister.
Of course. And I want you to know that I'm here if you have any questions or if you need any support. If you or your baby are experiencing anything like this.
Thanks.
Okay, let's get you connected with that lactation consultant, and I will see you at Chloe's visit in 2 months. She's going to be so much bigger.
Yes, she's growing so fast.
Here we saw how the key elements of CUES, which stands for confidentiality, universal education and empowerment, and support, can fit seamlessly into any kind of clinical visit. It's easy to integrate into conversations and helps to normalize conversations about family health and safety, particularly in pediatric healthcare settings where IPV assessment is not a standard of care.